You suspect that there's a likelihood that you were exposed to coronavirus given the nature of your job, a grocery store cashier. You are aware that essential workers, as well as their families, are among those at highest risk of exposure to COVID-19. Thousands of grocery store workers have tested positive for coronavirus in the recent weeks. In the midst of a global crisis, you are working longer shifts and taking on bigger workloads. You do not want to live in fear.
Currently, you are asymptomatic. You learn your local clinic is offering a 15-minute COVID-19 antibody test. You schedule an appointment to get this point-of-care test. On your way to the clinic, you think about the impact of getting tested. Traditionally, antibodies provide immunity, which can be protective for you, your family, and your community. Getting this antibody test could provide you with a peace of mind. Upon arrival, you fill out a short questionnaire in the office. You're greeted by a friendly staffer. It's time to take your test.
While we wait the results of our grocery store worker's test, let's take a look at the questionnaire that she filled out prior to the test. So as you can see, we have today's date, as well as her name, contact information, and location. These details will be important for generating the report once the test results are in, as well as locating follow-up services if they're necessary. We also have a section here for symptoms. Now, we did mention she is asymptomatic, but let's say she came in and was feeling some symptoms related to having coronavirus. So if she were to submit that questionnaire, so let staff know, to let our grocery store worker know that she needs to self-quarantine and seek further medical care depending on how severe her symptoms are. But she's asymptomatic, as we said. So we move on to the next section. And this is just a data collection section for us to see based on the patient's history with previous exposure to COVID-19 or being exposed to someone with a confirmed case, or if our grocery store worker or someone in her household is an essential worker. So that's the case, she's selected that option. So this was her final questionnaire. She submitted it. And so now the clinic staff will wait for the results of the test. This is a qualitative test, meaning a positive result will display for each type of antibody, IgG or IgM, based on whether these antibodies are above a predetermined threshold on the test. Now let's take a look at the report Novid software will generate in each scenario. So if our patient isn't positive for either antibody, they'll see the result here in the report, but will also indicate that the disease is not ruled out because these antibodies can take up to a week to form, sometimes more. Here we'd recommend to continue social distancing and potentially repeat testing based on future exposure. And of course, if symptoms develop, we recommend they seek medical care. However, if the patient is positive for IgM antibodies but negative for IgG, we see a different result, where they most likely had a recent infection with COVID-19 and are contagious. So we recommend they self-quarantine and retest in 2 weeks to see if IgG antibodies form. We also recommend they seek medical care if they develop symptoms. If they're positive for both antibodies, we see the result that this is most likely a subacute infection and they're possibly still contagious. So similarly, they should self-quarantine and retest in 2 weeks to confirm that they only have IgG antibodies. And lastly, if they're only IgG positive, then this means they're likely recovered and unlikely to be contagious. Now this is the result that we are hoping for because it means that the individual taking the test is eligible to donate plasma for convalescent plasma therapy research through programs such as that of the Mayo Clinic's Expanded Access Program. With that said, let's find out our grocery workers' results.
The results are in. The nurse informed you that you are IgM negative and IgG positive. He explains what this means and provides you with a report generated by the Novid software that has found plasma donation centers nearby. You feel relieved knowing that you have developed IgG antibodies. You are inspired to help others fight the coronavirus.